afternoon and Happy New Year. It has been so long, and I miss you guys out there in virtual world. I want to take a moment to thank you for joining us in our new series, Let's Talk. It is an education and resource series to help caregivers find the resources and education they need on their journey as caregivers. We will be here every third Thursday at 2 o'clock. So at the moment, click and share so we can share these resources across the state of Arkansas. So I want to welcome Gigi Gabriel. I want to introduce to many of you, some of you already know her. She is the Education and Outreach Manager here at Alzheimer's Arkansas. And it has been a great pleasure. She's been here a few months, and we would like to welcome her here and her expertise and resources. That's not funny, Gigi. You are.
Thank you, Carolyn.
So, if you would like to leave a comment or a question, please feel free to do so, and we will get to your questions and your comments to join the conversation, because there is no conversation without you. We may be talking virtually, but this conversation would not happen without you guys. And we want to make sure that we are here providing the resources and the education you need. So no conversation without you. We need your input. So Gigi, give us the honor of introducing our guest today.
Hey, we would like to welcome David Cook. He is Public Policy Manager with the Alzheimer Association, the Arkansas chapter. And today we're going to be talking with him about federal policies, things that affect us as caregivers in Arkansas, and just the different things that's going on right now in legislature that we should kind of know about. Welcome, David.
Thank you guys for having me, and it's a pleasure to be here. I want to say hello to all those who are joining us virtually as well, and I look forward to the conversation today.
Good. So David, let's start off with telling us a little bit about who David Cook is, what he does at the association, and maybe a little bit about the association, because we know that people often confuse Alzheimer's Arkansas and the association. So just give us a little feedback on that foundational part.
Yeah, certainly. So the Alzheimer's Association is, of course, our mission is to create a world without Alzheimer's and all other dementia. The association leads the way to end Alzheimer's and all other dementia by, working to accelerate research on a global and national scale, driving risk reduction and emphasizing the importance of early detection and maximizing quality care and support. We offer families care and support services through our care and support division. We have a 24-hour, 7-day-a-week helpline that never closes, and that number is 1-800-272-3900. The helpline is there to offer information and advice to callers. It's free of charge, completely confidential. That helpline is answered by master's level clinicians who can put you in touch with local staff as well to follow up. We do offer support services like support groups in various long-term care settings across the state. And as you know, the pandemic has shifted most of our care and education services virtual, just like you guys as well. All of us are shifting to a more virtual format, but we do offer our education programs virtually, and the helpline has the information on upcoming programs as well. But on the research scale, we work to advance research. We hold an annual Alzheimer's Association International Conference, which brings together thousands of researchers to share information and findings on the latest developments in Alzheimer's and dementia research. We help match people through our clinical trial program, our free service called Trial Match to match folks up with clinical trials to again advance research. And my role with the association is I work as public policy manager to advance policy that impacts families who are living and facing the challenges of Alzheimer's and other forms of dementia. We work on policy at both the federal level and the state level. And so my job is to create relationships with our local delegation offices, our 6 members of Congress, our 2 senators and 4 congressmen. And then at the state level, I work with our state legislators to develop policy decisions that will help improve quality and care and support services for individuals and families living with Alzheimer's. We advance policy, and it's one thing for me to go up and be a lobbyist at the Capitol, but our policy wins and the successes that we've been able to experience at the policy level, they don't come from our efforts, our staff efforts. They are led and driven by our advocates and our volunteers, and we'll talk more about that as we go forward. So more about me, Carolyn. I think I went around a way to answer your question, but more about me. I live in the very small town of Shirley, Arkansas. Our population, depending on which way the wind blows, is around 300. And so here in Shirley, I live with my wife, and our 2 children live at home, and then I have my 2 other girls live with their mother in Cabot. But I serve on the city council here in Shirley as well, and then of course. I office out of the Little Rock office before we went virtual. So
I'm just really trying to figure out where Shirley, like where in Arkansas is Shirley. So give me like some
landmarks or anything.
landmarks,
yeah.
city.
Yeah,
So I commonly refer to the town of Shirley as the suburb of Clinton, Arkansas.
Okay.
But we're about an hour north of Conway. So when you hit Conway and hit 65. You go about an hour and then make a turn in Clinton and you come to Shirley.
So if I know if I get to Shirley, I can just say, where did David live? And they like over here.
Yes, it doesn't take much.
Okay. So thank you for that. And, it's just so people will know who you are and understand like where you're coming from. So you really lead us into today's topic of Alzheimer's policy. So what role does policy play in advancing care and support services to individuals living with dementia and Alzheimer's?
That is a really great question. Policy is really all around us. It regulates everything that we do, from the speed limits that we drive on the highways to, the technology that kind of operates this, virtual platform. It regulates everything. And policy at the federal level, advances in policy help us to increase. That's where funding decisions are made, and so it helps us increase funding for Alzheimer's research. But also, policy plays a critical role in regulations to enhance quality care and support services for our population base and the population bases both of our organizations serve. And so at the federal level, it regulates how Medicare dollars are spent, which of course impacts long-term care services. It regulates, all the services that elders are qualified for. On the state level, policy intersects in the same way. And so it has a huge impact on long-term care services, access, and quality of care. Also, policy regulates public health campaigns of state agencies, and so it's important for us to engage and ensure that as the public, as the health department and other state agencies are engaged in moving the needle in Alzheimer's and dementia, that some of the public health campaigns include messaging around cognition, the importance of brain health, and all of that is regulated by policy. So policy, again, touches all sectors of the work all sectors of our population base, different populations that we serve.
So in one way, I hear you say, as caregivers and as those who provide services to caregivers, we must pay attention to the policy and the law set forth, because when a caregiver can't find the services they need, or there are gaps in services, a lot of that has to do with policy. Am I correct?
Correct. And people talk a lot about, systemic policies that actually, create disparities in the healthcare system. We know that they exist, but it's very important as caregivers and those who have lived with the challenges that they stay engaged in policy and they tell their lawmakers, how Alzheimer's and dementia is impacting their lives. They put a face to the disease. We know that it's a public health crisis here in Arkansas, but as you share your story, and we'll talk a lot about storytelling as we go on, but the opportunities for everyday citizens to impact policy decisions are so broad, and our lawmakers want to hear from us and hear how Alzheimer's and dementia and how policies affect us personally as well.
Okay, so how can we learn about how the association engages in the impact movement, and a little about what the impact movement is?
Certainly. So the Alzheimer's Impact Movement is the sister organization of the Alzheimer's Association. It's our 501c4. Our 501c4, the Alzheimer's Impact Movement, allows us to engage in policy decisions that our nonprofit cannot do because of tax reasons, of course. So it allows us to, to lobby and to organize our advocates. And so we advocate through the Alzheimer's Impact Movement. You can learn more about that by going to alzimpact.org. And we can talk a little bit about how advocates play a critical role in advancing policy. Do you want to do that now, or you want to save it for later?
Let's just kind of put it. We can do it later, but we're going to kind of put that to the side. We're going to put a bookmark on that and come back to, because I really want to talk about like the federal level, the policy update there, and like give us a little bit about what's going on.
Sure. So, as you might have noticed yesterday, we sworn in a new president. The new Congress has already been sworn in and has started their work. And this new Congress is the 117th. So we and our advocates will be working with them this new session of Congress to, again, support critical funding for Alzheimer's research and various other public policy initiatives that impact our population. What I wanted to share with you today is just some of the policy wins that we experienced last year and what that means for everyday Arkansans and how it impacts, again, the populations that we serve. On the federal level, we, again, this new year is a new Congress. And it's set to begin its work shortly. The new Congress will look just a little bit different. Democrats maintain a majority in the House, and the Senate is split with Democrats holding the tiebreaker. So what that means is bipartisan efforts will be more important than ever. And what's so grateful in a world and a culture that seems to be so divided over everything, Alzheimer's issues impact everyone, both red and blue. It is not a red and blue issue. It's a purple one. It impacts everyone. On the federal level, we work again with both Republicans and Democrats. Our efforts are strategically bipartisan. We work to garner bipartisan support of our issues. But I wanted to share with you just briefly some of the several important policy wins that we had at the federal level. And I want to go through those real briefly.
Please do.
Okay. Last year, we were able to see the Promoting Alzheimer's Awareness to Prevent Elder Abuse Act that was signed into law. This bipartisan effort was led by some of our key supporters, Senator Susan Collins and Chuck Grassley as well. But the Alzheimer's Awareness to Prevent Elder Abuse Act will direct and require the Department of Justice to develop training materials that will assist professionals who support victims of abuse who live with Alzheimer's and dementia, so that we can improve the quality of their interactions with this vulnerable population. We know that our population base is not exempt from elder abuse. These resources in this legislation will again direct the DOJ to take a more direct approach and engage on this issue by supporting law enforcement with training information so that those adult protective service workers, members of law enforcement, they understand how to identify signs of abuse and how to interact with individuals with Alzheimer's and dementia or cognitive decline issues.
Great, great. So you have a few more?
We do. On the funding side, we're really excited to announce that we were able to increase Alzheimer's and dementia research at the National Institute of Health by $300 million annually. This is an important funding achievement for our advocates and for our community. That brings the total funding for Alzheimer's and dementia research at the National Institutes of Health to $3.1 billion annually. And over the last 15 years, we've seen consistent increases in Alzheimer's research funding from the federal budget. And again, in a COVID year where we were engaging virtually, this is a huge achievement by our advocates as well. We were also able to secure funding for the BOLD Act. 2 years ago, Congress signed into law the BOLD Act, which is our largest infrastructure for Alzheimer's and dementia. That act creates again, an infrastructure so that we can begin to more strategically address Alzheimer's. And right now, the price tag for that bill was $20 million. We were able to authorize that at $15 million. That's very significant. Last year, we worked with the health department to apply for BOLD funding. They were going to be one of those centers of excellence that's identified on the bill. And they were not able to get awarded because the funding fell short. So we got another round of funding that we're excited about. Within this package, there was actually new funding of $5 million allocated that is going to be directly invested to target individuals who live in Indian country. We know that they are higher susceptible of developing Alzheimer's. We also were able to pass the Improving Hope for Alzheimer's Act. The HOPE Act accompanies legislation that we were able to pass, or an authorization of a billing code that was passed several years ago. The Center for Medicaid Services saw that we were starting to gain some traction on developing a billing code for Medicaid so that a part of the annual wellness visit, those who go in for their annual wellness visit could actually ask for cognitive screening and so that physicians can establish a baseline for cognition and begin to track cognitive decline, a very important aspect of the annual wellness visit. The problem was CMS didn't do an education behind that. What the Improving Hope for Alzheimer's Act does, it will help support provider education and outreach so that we can improve awareness and utilization of comprehensive Alzheimer's and dementia care planning services that are currently covered under Medicare. What we discovered is less than 1% of physicians and advocates were not having a conversation during the Medicare annual wellness business around cognition, mostly because they didn't know it existed and those services were available. So this education piece will increase utilization of that important service.
What's some amazing feats, and when you get back to the education portion of it, because most of us don't know what Alzheimer's look like, don't know what to look for, and it can mimic so many other things that having that baseline is going to be important in detecting. And God, it's just amazing feats. I'm impressed and speechless at this point.
It's prior to 2000, the association had limited engagement in policy. Most of our policy engagements, we were engaged in policy. It's always been a part of our mission, but we were most of our policy engagement was more grass tops, right? And so we did a lot of reports and helped support legislation. When we started seeing that, when we kind of moved to a different model where we used advocates to engage lawmakers, we started to experiencing a much larger increase of successes at both the federal and the state level. That's because, as the point I made earlier, lawmakers really respond to their advocates. And so these successes are only because the advocate engagement that we have around the country who consistently share their stories with their lawmakers, and make Alzheimer's a real thing for lawmakers. They don't remember facts and figures as much, but they do remember stories.
Yes.
They remember the challenge. That puts a face to the disease. And so our policy wins at the federal level, again, are 100% because of our advocates and the way that they work and the way that we advocate.
Well, I know a little bit about that. I've worked with David for a few years as an AIM advocate, and it's been one of the best opportunities I've had. I majorly work with Tom Cotton's people, and I've been talking to them for about 2 years now, just telling them my caregiver story as being a young caregiver. I was my mother's caregiver. She was 57 when she was diagnosed with younger onset. I was about 28 with 5 children under 7 years old. So my story is a lot different than the norm. I went into so many different hurdles, and even just trying to find help, trying to find assistance for her at her age. We didn't have the compassionate allowance at that time. We didn't have a lot of the things that people do now who do get that diagnosis. And so for me, AIM was definitely a way to use my voice and to be heard. And it was amazing just how it was nerve-wracking just going into those offices. But then once you go in there the first time and you meet everyone and they share their story too. So it's not just you telling yours, people open up to you as well. And that helps you. And as a caregiver, it helps hearing that you're not alone, especially from people in that position. And when you know that they're going to be telling their boss and speaking to you. And so it definitely gives a peace of mind for the caregiver. Like, okay, I'm being heard for once. Not only just through me talking, through the association, and all of us work together, Alzheimer's Arkansas and the association. And so by all of us working together, we really do get our caregivers' voices heard. And that's the best thing. That really is. It's that companionship and that partnership together and making sure that we have a voice in changing policy and that people are listening. It could be just such a great mental thing for us.
So, Gigi, that brings us kind of to like the state updated impact. David, give us some information on the caregivers, like how caregivers look, some statistics about caregivers in Arkansas.
Sure. Well, here in Arkansas, we do know that Alzheimer's, again, like everywhere else in the country, is a public health crisis that needs to be addressed, and the time to act is now. Here in Arkansas, the impact is felt. We know as of a report that was released in 2020 that 58,000 Arkansans just over the age of 65 are living with Alzheimer's. That number does not include those who live with younger onset under the age of 65. That population is difficult for us to get statistically, because sometimes those as Gigi mentioned in her story, it takes a while to get diagnosed. There's the way that we collect statistics is challenging, and a lot of those cases of younger onset often will go unreported as well. And so there are multiple challenges to get an accurate number, but based on statistics that we see in the national average, we estimate the total number of individuals with Alzheimer's here in Arkansas around 60,000. By 2025, just the number of Arkansans over the age of 65 living with Alzheimer's, that number will be about 67,000, which is an increase of 15% in just 5 years. A lot of that has to do with the baby boomers now reaching retirement age, and we are an aging state, but we know that the Alzheimer's numbers are going to continue to climb. For caregivers, there are approximately 178,000 caregivers who are providing care here in Arkansas for individuals living with Alzheimer's or another form of dementia. And Carolyn, I wanted to share with you just the impact of caregiving and how caregivers are actually our heroes here in the state, for multiple reasons. Often the care they provide, it goes unpaid, and so we average that the total hours of unpaid care that is delivered by family caregivers here in Arkansas is 203 million hours of unpaid care. And the value of that unpaid care is delivered a cost savings to the state of $2.6 billion annually if you value at that care. So caregivers make, especially our family caregivers, play a huge role in the delivery of health care for individuals who are impacted with Alzheimer's and other forms of dementia. So caregiving is plays a big role again in our public health system. It's very important for us to support their work as well.
So those are the state of Arkansas numbers, the 2 billion.
Yes, ma'am. That's
Just
just in Arkansas. Mm-hmm.
I mean, it takes my breath away knowing how important the services we provide and our partners provide to help caregivers do this. I mean, it's shocking, really, to me. But
every time I hear those statistics that come out every year in our statistical report, it is shocking, just the cost value and the impact that they're having in our state. In that last graphic on the right, you could see just how expensive treating Alzheimer's is, and how much we know that it's the most expensive disease to treat. In Medicaid cost alone, it's $396 million here in the state of Arkansas. And again, that cost and the burden to Medicaid is going to continue to increase. And so at the onset, you ask the question, how does policy intersect with Alzheimer's care? Medicaid is one of those key areas that we have to continue to ensure that those services that are so essential for our population base are continued and that they are expanded. I believe in how much you make a year, where you live, should not determine the quality of care that you receive. And so we have to continue to work to protect and increase access to Medicaid here in Arkansas for our population.
You're exactly correct. So that kind of brings us to what you guys and with our partnerships and other agencies have been working on, with you guys spearheading the Arkansas State Plan. So if you want to give us a little insight on the Arkansas State Plan.
Sure. So the Alzheimer's state plan is developed to help address the rising health crisis of Alzheimer's and dementia. Before we go into that, I just wanted to remind people, if you want more information about those facts and figures, please go to alz.org/facts, and you can access the entire report there as well. But on the Alzheimer's state plan, Arkansas was one of the first states to adopt a state Alzheimer's plan in 2011. Prior to that, states had minimal engagement until really the late 2000s, when more task forces were developed. And this kind of aligned with national efforts for a national plan to address Alzheimer's. As you mentioned before, Alzheimer's is not a normal part of aging. It has impacts across state agencies, in Medicaid, in public health, the healthcare workforces, facility licensing, aging, and many other areas in the state. But in many states, there's kind of lots of duplication between programs, or there's little to no action in certain areas, since exists this confusion on what agency should own which part, and we're seeing a lot of that as we work through the state plan process. But the state Alzheimer's plan is a state government plan that is developed after gathering information from the community, assessing the needs of Arkansans with dementia, their family caregivers, providers, and then taking that information and looking specifically at where the state government can act better to address the needs of individuals with Alzheimer's. Of course, the goal is ultimately that the state of Arkansas has a clear and coordinated approach to addressing Alzheimer's. In most states, the governor and legislator often note their final formal support of the plan and encourage its implementation, which is our plan as well. So our state plan here in Arkansas, again, first and the only one we have was 2011, so it was in bad need of an update. In the fall of 2018, we brought together partners from again, state agencies, nonprofit providers like Alzheimer's Arkansas, AARP, the Hospital Association, the Arkansas Healthcare Association, and a variety of others came together to begin this process of updating the Alzheimer's state plan. The working group continued to meet as we looked at data sets, and we kind of looked at some of we looked at the services that were currently provided for folks with Alzheimer's. We also looked at compared that to other states, and we came out with this state plan. We identified priority areas that we feel like the state needs to move the needle in. And that first priority area was, creating a need to increase awareness and encourage early detection and diagnosis, just creating more public awareness around Alzheimer's and dementia. We know Alzheimer's and dementia, that disease gets confused. There's a lot of public health education we need to do to help erase some of the stigma that is currently attached to the disease. And we know sometimes that stigma prevents people from reaching out, whether it's to receive a diagnosis or to share some of the problems they're having, and also can prevent people from getting the care and support services they desperately need. So it's very important we address that. Secondly, we looked on focusing on how do we increase access, but not just access, but also the quality of home and community-based services. How do we improve dementia care and long-term care settings as well? So we looked at several approaches to that. We also looked at the need, and as we talked about the statistics a moment ago, you realize that, but the need that the state has to increase its support system for family caregivers, whether that is increasing funding for caregiver grants or across the spectrum, we have to find a way to help support them. We know that when we do that, because caregivers provide a majority of the care, it takes some of the fiscal burden off of the state, but it also allows and prevents caregiver burnout and caregiver stress, and also allows folks who have Alzheimer's to age in the setting they most prefer for as long as possible, which is very important. But to create those systems, we have to find creative ways to support our family caregivers. And then finally, we looked at as the need for Alzheimer's care continues to grow, we also looked at the healthcare workforce, the current workforce that exists, but we also forecasted out the future needs of the healthcare workforce. But all that is included in our report. Our release of that report is anticipated in March. And so we are at the final stages of that report, and the working group is set to do their final reviews, and then we'll have it ready for release. We're really excited about the release, and we are hopeful that, or we will continue to work to implement it so that it doesn't end up another report on a shelf, but it actually is usable. It's a living document that we'll continue to update. And one of the recommendations that emerged out of the Alzheimer's state plan that I think is very significant to share with our listeners today is that the working group came together and collectively agreed that we need to create a permanent Alzheimer's Advisory Council here in the state of Arkansas. And so we are submitting legislation this session to create that council. That council will oversee both the development, the continued development, and the implementation of the Alzheimer's state plan. And so we're looking forward to working with our state legislator to pass and authorize that council. Which will create a permanent place at the table for us, the state government, to help us influence some of those areas that we discussed.
Okay, so this is really part that's important to all of us, and especially caregivers and people that are affected by Alzheimer's and dementia. Like, what role does advocacy play, and how do we get people involved?
That is a great question. Advocacy, as we've talked about, plays a pivotal role in advancing our mission, and I've already given them so much credit for our success. Again, I couldn't do my job if it wasn't for our advocates. One of the stories I like to share when I talk about the important role of advocacy happened to me just a little bit over a year ago. I was scheduled to meet with one of our congressmen in his district office. It was a meeting that I had planned for several weeks, a month out. The schedule for that meeting, I was to include an advocate. There was an advocate coming with me who was also a caregiver for her mother, who had late stage Alzheimer's. The day of the meeting, my advocate, as you know, as caregivers, things happen, and life is unpredictable. She was unable to make the meeting. And I share that story because when I showed up to his office, my meeting was scheduled for an hour. He blocked off an hour's time to meet with one of his constituents because he really wanted to hear their story. It matters to our elected officials. One of the first things the congressman said to me when I came into the room and he noticed I was alone is anybody coming with you? Where's Miss So and so? And I explained to him at the time, I said, look, something came up. She wasn't able to make it. I apologize. When my advocate wasn't there with me in the meeting, my meeting was cut from 1 hour, and he got me out of the door in 15 minutes. That wouldn't have happened had I had a storyteller, because in that moment, I became just another lobbyist. My advocate and the person that lives in his district, that's who he wants to hear from. And that shows you just how important, how much of a value our lawmakers take on their constituents. Lawmakers need to hear the impact that Alzheimer's is having on Arkansas families. And the way that they do that is by sharing your story. I still remember the very first time that Gigi walked into Senator Cotton's district office. I remember our walk up the stairs, the nervousness she had, how much she was shaking. She just said she was so nervous. And I remember her saying to me, I can't do this. I can't do this, because it is an intimidating thing. But Gigi just realized, hey, all you're doing is sharing your story. That's all you're here to do. And so when she began talking about her mother, I can't tell you what that meant to me. I lost my grandmother to Alzheimer's back in '97. And it seems like a lifetime ago. I still remember my grandmother. I remember how she smells. I remember so much about her. And as I do my work, I think about her all the time. But Gigi's story made Alzheimer's fresh to me, because I was so removed from that event, and I've forgotten a lot of things, a lot of mistakes we made as caregivers. But when Gigi began to share her story about her mother, the challenges they had, those things resonate with lawmakers. That's what they remember when they're on the House floor. They don't remember that there are 60,000 Arkansans living with Alzheimer's. They don't remember the 178,000 caregivers, but they do remember Gigi. They remember the story about her mother, their struggles. That's the face of Alzheimer's and dementia. It is not the association. It's not me. It's our advocates. And so advocacy plays a critical role in, again, painting a face and putting a face to dementia and the impact that Alzheimer's is having, because that's the overall arching story that we are trying to tell. Alzheimer's is impacting Arkansas families. Here is how. And so our advocates come in and share their story, and again, help us create the narrative that exists, that we know is there, right? That Alzheimer's is having a real impact. It's impacting everyday families. And Congress can't wait to act, and our state lawmakers cannot wait to act. The problem's already here. It's the fourth leading cause of death. It is the most expensive disease to treat. Our health department, our state agencies understand the crisis, and again, our lawmakers, as they go into this general session at the state level, they're going to consider in upwards of 2,000 pieces of legislation. Not every bill is going to make it and be passed, but that's going to come before them. They are hammered with issues every day, and they pay attention to the ones that and the constituents that they hear from. Those are the issues that they pay attention to. And so my point in bringing that up is, if we don't get involved in policy and try to influence decisions at the state level, decisions are going to be made, but money that could have been allocated to our disease is going to be allocated elsewhere, and we're going to miss opportunities to make our impact. But your voice and your story has incredible power, and it's what helps us, again, advance the narrative and tell the story of Alzheimer's real impact on Arkansas.
On the side of the caregiver, for me, I remember all of it. And every single time I go and talk to somebody, I get nervous. I cry every single time I tell the story. I've told it to so many people, and I cry the whole time. And they get emotional, then they tell me their story. It's no matter what, you're going to be emotional. No matter what, you're going to relive things that you don't want to relive. You're going to things will come up that you remember that you regret doing with your loved one. It's a journey as much as it is for anything else. But it's
And sitting in my chair, I want to speak to. I mean, I'm not immune to emotion as well, and so there's plenty of times that I've cried with Gigi and had to choke it back. But that emotion is
yeah.
it's
It's
real.
the genuine. It's the
Remember
genuineness.
things.
It is.
Yeah, you remember things that your loved one did, or you remember things of how they acted. I remember how my mother like inhaled and hear my father inhale when her diagnosis, because I was there with them. I remember me looking out the window while they were saying it to me. You remember, as a caregiver, you remember so many little details, and the more you talk about it, the better it is, and plus it becomes natural. And then once people want to hear you talk about it, you really do realize that you have an impact. Because in the beginning, you're like, oh, I'm just going to talk to this person. Who knows if Senator Cotton will hear my story? Who knows if they'll care? Who knows if the association is so big? Why would little old me matter? And I think that's it. We really don't think that our stories matter, but everyone's does. That's the biggest impact.
Well, the other impact of advocacy is that we're very strategic in the way we use our advocates. We also want to make sure that our advocates are comfortable, and that the experience is positive for them. That's what's most important to me, is creating opportunities for advocates to share their story, and that's my role at the association. It's the best part of my job, to create opportunities for individuals just like you to share that story. And to your point, Gigi, I think you make a critical point about you don't feel like you're doing anything. But when we have those meetings and you tell that story, you are a part of thousands of advocates across the country, and all of you are sending a unified message up to DC. And so that's what gives it weight and power. And the same thing happens on a state level, and a microcosm. All of our advocates are sending a unified message to the lawmakers, and we're telling them why it's important. And we need you. We need your voice more than ever. And lawmakers need to again hear from you, and they want to. But I think you're right. It is an intimidating thing. To ease that for advocates, we offer again advocacy training, and I will never send our advocates into a meeting unarmed with the tools they need. There are plenty of opportunities to get involved. There's many layers to advocacy. You don't always have to show up in person. Sometimes advocacy can just be sending a tweet on social media. It can be sending an email, drafting a letter to the editor, making a phone call. All those are ways that you can advocate, taking some of the baggage out of the word, the oxygen out of the word. Really, when I speak of advocacy, I just sharing your story. Your story has power. It's what allows our facts and figures to come in. It gives them impact. And so there are plenty of ways to get involved with the association and advocate. I would love to schedule time to talk to you and talk you through it. But if you want to learn more on how to stay engaged and up to date during the General Assembly, how to be involved in the policy issues that we discussed today, especially at the state level, you can text the word AIM, AR, to 52886. And there you will get a prompt on your phone to register to sign up for action alerts. And when you do that, you'll receive follow-up communications from me as well, invitations to upcoming events, including our State Advocacy Day event, Day of Action that's coming up. Our advocacy efforts have shifted to a more virtual format, but our resolve to impact policy is stronger than ever. Virtual engagement has created more opportunities for the association. It hasn't limited our capacity. And so I'm really excited about what our advocates are going to achieve, not only during the General Assembly, but also at the federal level as Congress comes in here in this next session as well.
And I want to hit it also at locally. I know through the association, I've always was able to talk to local news stations regarding when the state policy was changing and things of that nature. And so, yeah, it's not just going to talk to legislature. they hear things as well. And so locally, you'll be able to get your story out there. And then you could even help someone in your own city and in your own town. You could help Alzheimer's Arkansas. They could kind of see your story and like, how can we help this person? We have caregiver grants. We have all these opportunities and things that we need,
Right.
they need. So by talking, you're not just talking to, the government, you're not talking to these things, but you also get more opportunities to talk. And for me, the more I talked, the better I felt. And so through all of these layers, even locally, last year I was supposed to speak at Forum in DC, and I was given that opportunity through AIM. And then this year they contacted me again to do a virtual recording that they're going to play. So you have no idea how big your voice can be and just how it could really help anyone, especially your story, because we all have a different ones. Mine's a little different because I was so young and my mother was so young, but all of our stories really do need to be heard.
And the thing about stories, as caregivers listen is, even though your story is maybe the same, you're like, we're going through the same thing. There is so much uniqueness in your story because our families are unique. And yes, there's a part that
culturally
that is different. Yeah, but there are so many, every family is different. Every need of families are different. So just knowing that you make a difference and your story is different. I hear stories every day and I talk to caregivers, and although they are parallel in so many ways, they are so different and the needs are so different. So that's where the importance of hearing multiple stories come in and hearing how it's affect different populations, how it affects different caregivers. So it is very, very important. David, I don't know.
Carolyn and I often say that the most unique thing about your story is that it's yours.
Exactly.
And nobody can tell it like you, right?
Mm-hmm.
I can share Jeezy's experiences in the halls. It doesn't have the same impact as when Jeezy tells it. And that story is her story. It's not my story. And so you bring up a really great point. I mean, it is yours and your experiences matter. They matter, right?
And it's hard as caregivers to value ourselves because we're like, my identity was my mother for so long. I lost myself in that. I was a caregiver. I was a mother, and that's it. Because your career ends, everything that makes you who you are, you feel like your job, your passion, all that's gone. So now when you're just a caregiver, you're just a caregiver to your own self. Even though the world thinks you're amazing, you're great. I was told that all the time, and I'm like, no, I'm not. Just leave me alone. You get in that mindset where you don't matter. And so once you start using your voice and you hear people are listening, it completely changes. Like you really do start to feel like you're being heard. You start to feel more confident. You feel that separation finally from being a caregiver, and now you're back to who you were. So I was caregiver for 10 years, and then the past few years, I finally became Gigi again. And I think that matters. Caregiving affects so much more than just, what you're doing for your loved one. It affects every aspect of your mental health, your physical health, because you give so much. I think that's the biggest thing is really people understanding how much it affects a caregiver and how much financially is it really costing the state to take care of us too. How much of a burden is that when we lose our jobs and we lose income and we lose our health is failing? So it's a little bit of everywhere, and everyone can kind of do their part in it.
And there's such an incredible energy behind your voice, Gigi, when you said that. I wanted to also, I think people listening might say, well, I don't really like politics. I don't like politics either. I like the people I fight for. And it is not about politics. It's about people. Right. And it can be an intimidating thing, but you need to realize that the state capitol, that's the people's house. It's your house. Right. And so you need to get involved. Decisions are being made whether you're involved or not.
Yes.
But when you get involved, you can influence those decisions. And whether you believe it or not, I had a hard time accepting and understanding this reality myself. The first congressional meeting I ever held was with Senator Cotton when I was working with another organization, and it was in a DC office, and it made me so nauseated, and that I literally just could not eat because I was so nervous about meeting him. But one of the things that his staffer told me, who was actually from Arkansas, he said, and I won't forget this, he puts his pants on just like you do every morning, right? And it calmed me down because they do. They're people. They're residents of the state. And they They are just like us. They want to hear from you because their job is to support your concerns. And what's amazing, and we talked about the story of the congressman earlier, they want to hear your story. It's what matters to them. It's what they remember. And again, that's we're just asking you to share your story.
So, David, it has been an honor and a pleasure for you to take time out of your busy schedule and your day to share what's going on at the association, what's going on in Arkansas to help the caregivers. I mean, listening to you and Gigi and understanding that we all can play a role. We all can do something, because sometimes we feel like we can't do anything. And, how do we get services? And why can't I get more help with taking care of my loved one? Why can't I get respite care? You can help just by being an advocate, just finding a way to put your voice somewhere. And like you said, it's not always about speaking, but other ways to work with the policies and the association to get things done. So if they wanted to contact you about maybe being an advocate or sharing their voice or helping, how would they do that?
Yeah, so please feel free to reach out to me. My personal email is on the screen there. Please send me an email. I'm again on Facebook and Twitter. You can find me pretty easy there. But please reach out to me. Also, my number should come up on the screen in a moment as well. Please sort of give me a call. I'd love to have a conversation with you. But I again want to remind the listeners, to stay up to date on what's happening this session, please go to 5288 or text AIMR to 52886. We flashed it earlier as well, but you can go back to my number, Zach. But feel free to give me a call as well. That's my number. You can call me, and I'd love to have a conversation with you about the advocacy opportunities that we have here at the association and ways for you to get involved. And thank you guys for hosting me today. This was an amazing conversation. I really appreciate the time today.
Oh, David, you're great, and I love talking to you. So it's good to see your face. It's like forever since I've seen you. So, Gigi, you can take it out for us.
All right. Well, thank you, David, for coming on today. And in February, we will have we have coming up is Lauren Miller with Right at Home Metro. She'll be coming up next February, and then we have Coffee with Carolyn and Gigi. That will be a caregiver, an online virtual caregiver.
Where's my coffee cup? I can't find it.
Side to side. A little that way. Yeah, there you go. That's right there. It will be at 10 a.m. the first Tuesday of the month. So the first one, actually the last Tuesday. So it'll be January 26th. You'll be able to see Coffee with Carolyn and Gigi, and you do have to register, and then you'll get sent a Zoom link for us. It's for caregivers, and it'll be a safe space so we can talk and you can ask us questions and just really share what you're going through, and plus also how we can meet your needs. What help do you need? What information do you need? Because we can't help you if we really don't know exactly what you need help with. So it just helps us become better at our job as well as association and kind of sharing all these ideas and thoughts for caregivers. So hopefully we'll see you guys in February for let's talk again.
Let's talk. Thank you, David.
Thank you, guys. Y'all have a great day.
All right, you too.